Hello everyone, my name is Zhu Xinwang. I am a physician of the nephrology department, the first affiliated hospital of our school. Today, we will briefly discuss how to diagnose and treat urinary tract infection, abbreviated to UTI. Today's content includes laboratory findings, diagnosis, treatment, and prevention. The laboratory investigation. First, how to diagnose a urinary tract infection. In most cases, routine urine tests can confirm the presence or absence of UTI. Usually, we can see white blood cells or casts. Positive nitrate represents E. coli infection. Definitive diagnosis of UTI requires the presence of genuine bacteriuria, the traditional standard of which is 10 to the 5th power or more uropathogens per milliliter of voided midstream urine. The imaging investigation. For complicated urinary tract infections, we will perform the following imaging examinations: ultrasound, CT scan, MRI, intravenous pyelography, retrograde ureteropyelography. The diagnosis. When it is suspected that the patient may have a urinary tract infection, we still need to know where it happened, in upper or lower urinary tract. It is acute or chronic, and are there complications? Location diagnosis. So how to distinguish upper urinary tract infection from lower urinary tract infection? Urinary. When there is systematic inflammatory response, white blood cell cast in urine test, decreased urine concentration function, tenderness or beta-2 microglobulin and NAG in urine test. Most cases are upper urinary tract infections. Differential diagnosis. Urinary tract infections are usually differentiated from the following diseases: the tuberculosis, urethral syndrome, infections caused by other pathogens, prostatitis, and a bacterial pyuria. The principle of treatment. Drink plenty of water and urinate frequently. Correct susceptibility factors. Except for women with simple lower UTI, all need urine cultures. When drug sensitivity results are not reported, the effective antibiotics against gram-negative bacilli are preferred. Then choose antibiotics based on drug sensitivity results. Acute cystitis use high concentration antibiotics in the urine, and pyelonephritis selects antibiotics with high concentration in urine and blood. If invalid with 48 hours, change to other medicine. Use nephrotoxic drugs with caution. Oral administration for the milder, intravenous for severe cases, and combination medication for the severely infected. The medication course for the lower UTI is short and long for the upper UTI. Symptoms disappear does not mean cure. Reassessment after treatment is needed. Consider other infections when treatment is ineffective. How to treat acute cystitis. Short course regimens are recommended as first-line treatment for acute uncomplicated cystitis because of comparable efficacy, better compliance, lower cost, and fewer adverse effects than with longer regimens. Empiric oral treatment with 5-day regimen of nitrofurantoin, a 3-day regimen of TMP-SMZ or trimethoprim, or a single dose of phosphomycin. How to treat acute pyelonephritis. For mild acute pyelonephritis, oral antibiotics for 14 days. For other type of pyelonephritis, intravenous injection for 14 days. For severe cases, use combined treatment. Choose effective antibiotics according to drug sensitivity test. Treatment of recurrent UTI. Women with recurrent cystitis may benefit from behavioral modification, such as avoiding spermicides, increasing fluid intake, and ensuring postcoital micturition. Antimicrobial prophylaxis has been shown to reduce the risk of recurrent cystitis. The UTI during pregnancy. Choose less toxic antibiotics. Tetracycline, chloramphenicol, quinolones should not be used. Compound SMZ, aminoglycosides, can be used with caution. For asymptomatic bacteriuria, non-pregnant women, no treatment. For pregnant women, active treatment. For preschool children, be treated. For seniors, no treatment. Those with complicated urinary tract conditions, treat as appropriate. The prevention. Drink plenty of water and urinate frequently. Maintain personal hygiene. Try to avoid using urinary tract equipment. Prevention before and after sex. Patients with bladder and urinary reflux should develop a habit of secondary urination. That's all for today. Thank you for your time.